Okay, Dr. St. John here, and I want to describe and explain how we do what is called resonance testing to, first of all, identify where heavy metals are in the body, what concentration they're at, and measuring the reduction and removal of them over time. So we have vials here, and it's backwards, but you can see aluminum, you can see mercury right here. So we have all these vials and they're homeopathic preparations. And if you drag these vials over the body while muscle testing, and let's say there's mercury in the liver, for example. If we held this vial here and muscle tested simultaneously, if there is mercury in that liver, we're going to get a weak response because this mercury vial has 1x to infinity x concentrations of mercury. It's like we call it the master vial. So it has many different homeopathic concentrations. Then what we do is we have another test kit, we call it a resonance test kit, and these have many different concentrations, okay? And we will team them up with the master vial. So I have the 1x vial, that's the largest amount of a substance. And what it will do is amplify just, if you team these up together, it'll amplify just the 1x concentration in the master mercury vial. If that weakens the patient through muscle testing, okay, while dragged over an area, then it indicates that that's the concentration that they're dealing with. Then what we're going to do is we're going to determine through supplements, and we have many different supplements and chelators, and we'll put that into the mix, and we'll actually have the patient smell or taste the nutrient, like a chlorella, or we have something called HVS metals from this company. We have many different, chelators. We'll figure out what negates the weak response, okay, to this resonance testing. Then we'll give them that supplement, and then they'll come back, and over a period of time we'll monitor this. So let's say they come back a week later, we recheck the 1x concentration and it no longer weakens. Then we'll go to the 3x concentration, okay, and team that up. And then we'll go to the 6x, 10x, 20, 30, and over time we're seeing a reduction in the concentration of the heavy metal. And when we get all the way through the vials, there's two rows here. Okay, this row is 1 through 100, and then this is like 125 through 500. When it gets to be about 300 to 400x, it's a very minute amount of the metal, but we like to get it out as much as we can so we get through the 500x vial. So that's how we determine this. It's a little more cost effective than doing, repeat hair analysis or urine tests. It's extremely accurate, and it can check the entire body. A lot of times these metals collect in the brainstem, frontal brain, certainly the liver, where toxicities, are processed through kidneys. But that's resonance testing. So we'll see the patient over a period of, they're usually on a nutritional program for some other health ailment, and we're identifying these heavy metals through our nutrition response muscle testing, we call it. But for a dental patient that's getting mercury removal, what we do is we have a protocol prior to them going to get the removal, then immediately after, and getting a patient into our clinic and assessing the situation right after removal would be ideal, because we can determine the exact dosage that the patient needs of certain nutrients. some things look good on paper, but when you actually do the muscle testing, the body will not accept certain chelators. And we also make sure that we have enough drainage remedies to keep the channels of elimination open, make sure the bowels are moving properly to get these metals out. I mean, I would say at least 50% of our patients have some type of heavy metal toxicity when they come in that we identify. So this is routine. I've been doing this for 10 plus years. I have a huge respect for heavy metals, and when you get the right program, they do come out. And sometimes people can have healing crises, so we can monitor that and minimize that from occurring. So hopefully this was helpful, but I think working with some of your patients would be ideal because it's hands-on. A visit takes about 10 minutes, so if someone just wants to make sure they're getting the metals out, we can track those. Let's say it's just mercury that they're dealing with, or aluminum, because that's common with amalgams. We can usually get one of those metals out in about 3 months. Okay, I'd love to meet with you and go over this in more depth. Take care.